the dyslexic learners, 79% had a vision issue. So many. And what we see is that they are often lumped in, oh, it's the dyslexia, and nobody looks for a second issue because they think it's all attributed to something else. I definitely see a lot of patients who come in with either a suspicion that the kid has dyslexia or a diagnosis of dyslexia. And I find these to be really fascinating cases because I really like to tease out what could be a vision problem contributing to this case and what is dyslexia. I definitely think that dyslexia is a language-based problem. It occurs, it's something that's genetic sometimes. It's a real thing, but definitely there is a high overlap with vision problems. And a lot of people lump everything together that these kids are experiencing and attribute it to dyslexia. So, for example, if a kid comes in and the parent's like, well, they have dyslexia, and I'm like, okay, well, let's see what's going on with vision. They might have skipping words, eye strain, and headaches. Well, that's not dyslexia at all. That's not caused by dyslexia. There are some things that could be either, and you have to have respect for symptoms that could be either, which is letter reversals. Sometimes that's dyslexia. Sometimes your eye tracking so bad that you might flip a B for a D because you don't know where your eyes are or they're moving backwards when you think they're moving forwards. Sometimes the difficulty with spelling is because a kid has a hard time seeing the middle of the word because it's mushed to them visually. And so kids who have difficulty with the middle of words or the ending of words, that could be either. Of course, reading speed, fluency is affected by both. What else is affected by both? Avoidance of reading, which is a big one. Of course, dyslexics are it's hard work for them. It's hard work for their brain, so they don't want to read. But that might be why we see so many more vision problems in this population. They're avoiding, so they're not developing the vision skills. There is a fantastic article that came out a few years ago. It's linked on our website. And what they found is they take a group of typical readers and they take a group of dyslexic readers, and they did all these vision tests on them, the things that I do every day. And they identified that in the typical readers, there was 33% that had some type of vision problem, tracking, teaming, focusing. They had some kind of functional vision issue. And 33% might sound high. That is actually dead on with every other study that has shown what the prevalence is. It's about a third of kids in every classroom. Okay, so that's right there can be a shocking stat for some people. But the dyslexic learners, 79% had a vision issue. So many. And what we see is that they are often lumped in, oh, it's the dyslexia, and nobody looks for a second issue because they think it's all attributed to something else. So when we work with these patients in therapy, our goal is to remove the barrier. They're still going to have dyslexia, possibly. Some of them magically don't, but they're going to have less eye strain, less avoidance. Dyslexic kiddos who are in tutoring, they are spending even more time than average kids reading. They have more opportunity for eye strain and these issues. So we want to remove the barrier, and the buy-in I get from kids, as I say, I'm not going to make you love reading. I'm not going to decide for you what you like, but wouldn't it be great if it was easier? Wouldn't it be nice if it was just easier and faster to get through and you made less mistakes? And you'd be hard pressed to find a kid who truly said no. So that's what our aim is for the dyslexic kiddos. We're just treating the vision issues, but I'd really like to tease out what's vision and what's dyslexia. And I have a few screenings for dyslexia in kids who aren't diagnosed. I'll have them read out loud for me and just kind of hear what's going on with their reading. I have a dyslexia screening test that it picks up the kids who have really severe spelling issues with dyslexia. So I like to kind of dip a toe in the water for those who I'm like, what's the most important thing for them to be working on?
Do you have many clients who have had a dyslexia evaluation, cognitive testing, academic achievement, skills, all those kinds of things, and then they work through the vision therapy and then they get tested again? I don't know if you see clients back or if you might just see them one time and then that's it, but have,
I think the hard part is they often don't go back to do the neuropsych testing again. So because what'll happen is, and this does happen sometimes, and I'm not saying it happens all the time, but it is more likely to happen the earlier I get the kiddo. And I think that's because the longer these vision problems go on that look like dyslexia, the more embedded it becomes. And then even if we fix the vision problems, now their brain kind of functions that way for reading. So it's harder to retrain that reading pathway. But the younger kids, I've had a kiddo who, and this has happened a few times, I'm thinking about one in particular, 2 years behind in reading, full neuropsych, dyslexia, and like, a few other things too. And then we did 25 or 30 sessions of vision therapy. By session 20, they were caught up, 2 years caught up in reading. And at that point, they're not going to go back and repeat the neuropsych testing. That's, they're just like, well, we're just happy. She's doing great. She's on grade level. And by the end of therapy, she was above grade level. So unlikely that kid would test as dyslexia if they were reassessed, but hasn't gone back to do it.
What about related learning disorders like dyscalculia and dysgraphia? Do you see, are they helped by vision therapy? I mean, I know it's the motor component as well. And do you see, or are there any symptoms of problems related to math and problem solving and writing that can be due to a vision problem? You might have talked about this a little bit earlier, but
Well, writing's a big one. And so I have a lot of kids who we will be able to see their handwriting samples improve after they've done some vision therapy, because they aren't able to really, your eye should lead your hand as you're learning to write. And again, earlier the better, because we get those motor patterns ingrained. And then it's harder. So when I have a young kid who comes in who's doing, really smushed writing, or it's up and down, or it's really crowded in some way, or really big. Sometimes those kids will write big because they can see it better. Big writing is another kind of red flag. And then after they get some better tracking and their vision therapy skills up, we do see the writing improve. Now, it's not saying that treating the dysgraphia is treating a part of what they're struggling with. Similar with dyscalculia, it's more so that's more of a mental skill. So with dyscalculia, you're seeing like the math concept piece. But we find that with kids who are struggling, we will actually work on those visual processing pieces of math. And so I don't know if how common this term is, but there's something called summatization, where you look at a number, like an array. You look at like a domino, let's say, and you can just instantly, without counting, you see what that number is, right? So that is a skill that is a huge precursor to math. So if we have a whole bunch of activities to work on summatization, so that we, flash a number, flash a domino. What's that number? They're learning to recognize the patterns of what that number is, and that can help boost their processing skills for math, because it's a significant building block for math.
all right. For listeners who want to connect with your practice, Denver Vision Therapy, or with you, or to find out more about your services, where can they find you?
So probably the best place is at our website, which is denvervt.com. And we do try to have a lot of information on there. I really love to educate. So we've put a lot of articles on there about different vision problems. There's the symptom survey, there's research articles, there's a lot of resources there. And you can also text our office, which is a cool feature, or you can just contact us on the contact us form. And the front desk, really, we try to keep up really well with that, getting back to people quickly.
It's been a pleasure talking with you. Thank you so much.
You're welcome. Thanks for having me.
That's it from us today. As always, you can find more information as well as resources on our website, individualmatters.org. We hope you'll join us at the next podcast, where we'll continue to explore topics around successful living, learning and education, and child development, and share ways to help you live a more positive and fulfilling life.
The preceding information is not intended to provide or serve as medical, clinical, or educational advice. Individual Matters is not responsible for the accuracy of guest statements. All information should be validated independently. Please consult with your doctor, mental health provider, attorney, or other appropriate professionals before making any personal decisions for yourself or those in your care.